Hi everyone, my name is Caspar Safarlou. I'm doing my PhD project at the UMC Utrecht in the Netherlands. I'm part of the Expanse project of Exposome research projects. My research is on the ethical aspects of exposome research. And Evert Ben has invited me to give a critical perspective on health equity, what it is and why I think that it's not a correct ethical idea. So I'm critical about the concept. I tend to think about exposome research not necessarily as directly being about how to achieve better health in the sense of achieving a more just society. I agree more with Ziz's description and Christopher Wilde's idea of exposome research as being about gathering lots of data on the environment and getting a grip on disease etiology, of understanding how the environment affects health. And this may have all sorts of implications for how we try to improve health. It can be through personal interventions, it can be through intervention on a group level, on a societal level perhaps. But this to me is not necessarily connected to an idea of health equity, even in the very conception of exposome research, as opposed to ideas like planetary health, which for instance have a very strong connection to ideas of health equity. But more on that later. Let me tell you something more about my PhD work. So my PhD project consisted actually of 3 parts. So first, the question was to map the ethical aspects of exposome research, look in the literature what has been said on exposome research, and map and categorize the ethical aspects. The second part was to do citizen panels and to see what citizens think about exposome research participation in an ethical way, what they see as norms for data sharing and collection. This is something that we're still working on and writing up on. We've had the citizen panels, but we still have to write the paper and get it published. And lastly, as it is an ethics PhD project, the idea was that I analyze a number of ethical aspects in exposome research, on which now there's already been 3 published papers, one on privacy protection in multi-omics databases, one on ethical aspects of non-hypothesis-driven research, which really goes to this question of broad consent and how can we have a principle of data minimalization that does not conflict with ideas of discovery-driven research. And lastly, I've written a piece together with co-authors as well on the nature-nurture debate in exposome research and whether this is the correct way of thinking about what the research is all about. More on that near the end. But the first part of the project was about this mapping of the ethical aspects of exposome research. And here it was pretty hard to find papers on the ethics of exposome research, because if you look for exposome plus ethics, you will find about 7 papers, maybe 2 conference abstracts, and there wasn't much to be said about it. So what I did was a more creative approach. I looked at the various fields and technologies that underlie exposome research to generate a query that it gives you a lot of more papers. But then the task was to creatively connect these to the enterprise of exposome research and categorize a number of ethical themes. This has resulted in this paper, a systematic review of the ethical aspects of exposome research. I encourage you to browse it. I've written it in a way in which it should be approachable for exposome researchers who also themselves might not be ethicists or trained in ethics themselves. Instead of categorizing ethical aspects by means of broad principles, for instance, beneficence, non-maleficence, autonomy, and justice, I've looked at, okay, what are tools or more broadly values that exposome research has, for instance, particular measurement technologies, data sharing, questions of bias, the reference exposome, property rights that people might have in tissues that they share, and for instance, what the implications should be for public health of exposome research. Part of it is also about product biomonitoring, which is something that also came up in the review. And so this is something that I encourage you to look at. It's 40 pages long, it's pretty big. Evert Ben has told me that he is I attempted to read it a couple of times, and it's a pretty long thing to get through. But if you look in the attachments in the supplementary materials, there's a nice 2-page summary of it, which I encourage you also to have a look at, and then which can allow you to browse the different ethical issues according to your interests. I generally think that we don't think about ethics research and ethics enough. Indeed, ethics is about guidance that provides you knowledge about how to act. And usually we absorb the values that are around us in society. And I think that this is also true for conceptions of health equity often. So let me get to what health equity is. Daniel already told us a little bit about it. Ideas of health equity are based on an ideology or set of ideas called egalitarianism. This view was popularized in the 1970s by a Harvard philosopher named John Rawls. He wrote a book called A Theory of Justice. And his view and the broader view of egalitarianism, this view of justice, of social justice, is the view that all people should have equality, should be equal in a certain respect. Now, what does this mean then? What does equality then mean? It doesn't simply mean equal application of proper standards. So, for instance, judging the paper of your student by the standards that are set out and are equal for each student. It's not simply equality before the law. These things are usually implied in conceptions of egalitarianism, but it's not what equality is directly viewed to be about. It's about making people equal in some particular dimension. This could be income, abilities, wealth, opportunities. This could be equality of opportunity as well as equality of outcome. And this is something that Daniel has also talked about and mentioned. A typical example that's big now in the Netherlands is university admissions. There are certain educational programs like medicine, for instance, which have a set number of people that can be admitted in total just because there's a limit on capacity. And then there's the question of, okay, how do we provide then an equal opportunity to all students to try to get a position in medicine degree program? And then the question becomes, okay, how do we do this justly? And in the Netherlands, there's often the idea that everybody has the required academic qualifications. They have finished their middle school, their VWO, as it's called. And so if people are equal in this respect, they should have an equal opportunity. So perhaps we should have a lottery. And to me, this is incompatible with ideas of justice. So to me, justice is about treating someone on the basis of their conduct and character, and on the basis of what you do, how you act. So I would much prefer, in my view of justice, something like a test to see, okay, who has the knowledge, who is best well suited for a particular degree program, who is best fit to finish this program on time, do it well, become a good doctor. The Dutch minister is quite critical of this idea because he questions, well, wouldn't there then be students who have parents, who have fat wallets, who train them to perform well on these tests? And isn't it thus unfair if we have a test for university admissions based on people's knowledge? And then, of course, what's the alternative? And he says, well, maybe we should test people on the basis of things that you cannot train. And yeah, this to me, again, does not make sense when we think about justice. The same is true when we think about judging papers. So if papers or a test that a student makes has to be judged, I think it has to be judged on the basis of the question, do they understand the material? Egalitarian views of justice promote ideas such as grading on a curve. So there should be a set distribution of grades, and people's grades aren't determined based on how well they understand the material, but based on how well they score relative to each other. So if you go back to the systematic review that I mentioned, we have also written a couple of sections categorizing the different views from egalitarianism that that we found in literature, and looked at what they say about aspects of exposome research. And one of the things that has also been talked about is personalized medicine and personalized prevention. And this is an example of one of the things that we found in the literature, an ethical aspect. I'll quote here, a risk for public health is that new technologies and tests catalyzed by personalized medicine might result in increased social deviation between those who can afford them and those who cannot. And I don't see this as a risk at all. What's wrong with having money and paying for a technology that allows you to improve your health? To me, health is exactly an individualistic thing. It's your health. It's the state of your physical well-being. And there's nothing wrong with creating a new technology and buying it and using it that improves your health. To me, this is not a risk at all. At the same time, I think that this represents a certain attack on justice. Because let's say that you're trying to create this technology to improve human health, and suddenly there's a risk, namely that this might increase social deviation between those who can afford certain technology and those who cannot. It's a way in which people are punished for their virtues. It's good to improve your health, but not if you're part of a certain a class or group of people to whom this should not be allowed. And I do not see why it should not be allowed. And there's also a way in which these types of views of egalitarianism put scientific progress at odds with, let's say, a view of justice as a personal virtue. Because, of course, scientific progress often happens in countries that do have resources to invest in scientific research. And so what happens is that new scientific technologies do create more inequalities between groups of people. But of course, what is the alternative? Is it not to have this scientific progress? Should scientists somehow feel guilty about the scientific progress that they create, because this might cause a deviation between certain social groups? I disagree with this, and I think that it sometimes has caused unearned guilt in researchers who do fear that their scientific advances might differentially affect different groups. Well, is this a straw man? As the idea that people should have equality in a certain respect, something that people actually think. Commonly, this idea of strict egalitarianism, where everybody is given the same thing in order to make people equal, which you can see on the left side of this often used comic, is viewed as wrong, because it's not about making people equal in the sense of giving them the same set of goods, but it's about giving everybody what they need to achieve a certain state. A view of equality of outcome is involved as well. And this is often what is called equity. But to me, still, this is not a view of justice. It's not about what people deserve, but it's about what people need to have a certain outcome. This is also part of the WHO definition or description of health equity. It can be achieved when everyone can attain their full potential for health and well-being. And that means giving people things not primarily on the basis of what they deserve, but on the basis of need. This is a quote also from the paper, which more represents this equity view on justice. So this is a quote from the review itself. So we describe what the paper says, which is in this case the third paper in the list of things. The third paper argues that precision health will only be valuable if it can be advanced equitably. The paper goes on to argue that for precision health to be valuable, it must be prioritized among under-resourced settings for underserved, marginalized, and rural populations. It argues that precision health needs to be conducted with historically marginalized communities first, instead of high-resource settings, because otherwise it is quite likely that precision health will exacerbate inequities. And to me, this is a more apologetic version of strict egalitarianism. It says that, okay, it is fine and good to create a certain technology, but it's only valuable if it goes to the people who are most in need first. To me, this is still at odds with a conception of justice as giving people what they deserve and judging them by the content of the character and their actions. And there's a way it's also at odds with scientific progress. If we want to have scientific progress, and this happens in countries which have the resources to do so, then it is then it's a problem if you think that this is not how this is not a place in which to spend these resources. So again, what's the alternative? If we look at this conception of health equity as giving to people according to their needs, this to me contradicts the ideal of individualism. You might remember the slogan, from each according to his ability, to each according to his need. This to me contradicts individualism, the idea that each human being is an independent, sovereign person with an inalienable right to his own life. And that means a right and resources and a right to property that cannot be taken from him by others. Justice is about what people have earned and deserve based on their character and their actions. And this means that justice does entail unequal outcomes. Some people deserve less because they've earned less, others deserve more because they've earned more, and of course some people are in situations not of their own making and of their own fault, in which case it's not an issue of justice, but it could be an issue for improving society and improving people's state. However, justice, I think, is an ineliminable dimension in analyses of health inequality. If we look at different people's different states of health, if we look at health inequalities, this is a very informative thing indeed. How John Snow found out that the water pump was infected was by looking at health differences between people. But that makes health inequalities informative about the causes of health and disease, but it doesn't necessarily or primarily make them an ethical issue. At the same time, one of the very much problems I see in egalitarian views of justice is a certain vice. Why would it be unjust if well-off people get personalized medicine? We see personalized medicine as something that is good, that can improve people's health, but instead of some people having it, we say in ideas of distributive justice, they should not have it, other people should have it who are more in need. Well, what is the name for one thing? To deny someone something that you want? Is this jealousy? Not really. Envy, yes. So I think that an important motivational element in thinking of social justice is envy, and I think that this is a vice. This is not a good thing, and this is one of the reasons also why I think that egalitarianism is not a moral ideal. It appeals to envy. Well, recommended reading. So this is one of my favorite works in ethics by Professor Tara Smith. At the University of Texas in Austin. Ayn Rand's Normative Ethics. It discusses different virtues, rationality, honesty, justice, productiveness, integrity, pride. And in the discussion of justice, there's also an analysis of egalitarianism, which I've drawn on for this critique today. Let's see, how am I on time, by the way?
Well, you should have 5 minutes, yes.
Okay. So, I've been invited, of course, to talk about health equity, but one of the things I like more is talking to you about the things that concern you and the things that you think are important as Exposome researchers. And then I haven't heard much about health equity in the previous day, but I've heard about some other ethical ideas. For instance, there was a short demo of the AI chatbot saying you shouldn't worry about air quality because it's good today, and so it's fine for you to go out for a walk. This to me seems to make sense, but of course, you could also say, what's the opposite? If the air quality is bad, shouldn't you go out for a walk? Well, if you don't go out for a walk at all, maybe it's good for your exercise to walk out when the air quality isn't that good, if the alternative is not going out at all. In other words, when we think about the actionability of exposome research, we need to have alternative sorts of action and alternative ways to act in mind. One of the other things that was mentioned is how participants in research want non-health related values. This is, I think, also important. Indeed, for instance, in the citizen panels that we've done, some participants have said that they also find it informative just to see what their exposures are as compared to the other people in the group, because they're curious. These ideas of actionability, how do we move from information to action in exposome research, also needs to take in mind that actionability always implies a certain value. And this need not necessarily be health. They can also be non-health related values that we get out of exposome research, or that we can provide to research participants, which also benefit us, because then there might be more research participants, and we have more, can gather more data and have more power. At one point, the sugar tax, the idea of a sugar tax was mentioned. Here we can have a discussion, of course, about paternalism versus personal choice. Similarly, in thinking about prevention, and for instance, thinking about e-cigarettes versus smoking, we need to think about, okay, what do people like about smoking? What do they like about these e-cigarettes? What are, let's say, the upsides or perceived upsides of unhealthy behavior? These are things that need to be taken into account and thought about when thinking about the implications of exposome research and how we can use it for prevention. There was a lot of enthusiasm for a policy advocacy, but I would say that we first need to think more about values. What good values are, how they interact, what a good hierarchy of values is, and how the value of physical health features in a well-lived life. And this goes to the second of Evert Ben's pictures as well. What is the role of physical health in a well-lived life, and how do we take health risks for other values? These, I think, are all interesting things, for which I would recommend you the other paper that I mentioned on the nature-nurture debate. This paper contrasts this view of actionability that I've been talking about and acting in favor of different values and having action alternatives, in contrast to the nature-nurture debate. But I think that a lot of the paper is also interested if you're just thinking about how can we achieve values with exposome research, apart from this idea of a nature versus nurture debate.